Right, so Keir Starmer has been having a bit of a reshuffle today, and there's probably a few videos in it, if I'm honest. Maybe not, see how they go. Because it's just unfeasibly horrible in several different ways, with several different appointments. But far and away, the standout for me has been the resignation of Dr Rosena Allin-Khan, quitting the front bench because Keir Starmer has decided there's no space for mental health within his cabinet portfolio. Well, really. Mental health is one of the biggest health crises of our time, not least because more people are affected by it, with their lives being made ever harder, disproportionately high amongst those targeted by sanctions, the poorest, the sickest, the disabled having their conditions worsened. But pretty much every single demographic going in this country is now seeing more and more cases of mental health suffering and struggle. The pandemic particularly saw cases skyrocket, particularly amongst children. As is ever the case, though, there has been underinvestment and abandonment of the issue under the Tories, leading to massive waiting lists to be seen, a lack of trained mental health doctors and nurses to help deal with this issue. It has been a problem under the Tories for so long that Theresa May, remember her, back when she was still in charge of the country, seems ages ago now, doesn't it? She created the cabinet post of Suicide Minister, the full title being Parliamentary Under-Secretary of State for Mental Health, Inequalities and Suicide Prevention, which is just the most catastrophically named government post. What an admittance of failure, when with proper mental health provision, you would get suicide down, and suicide rising, or suicide cases rising, would never have been a thing. Now, the first holder of this post was Jackie Doyle-Price, but she was soon replaced by, as if this really helps people's mental health, Nadine bloody Dorries, which is frankly just pissing on you and calling it rain. The job has had the suicide bit stripped out since, a bit too on the nose for modern Tories, and is now Parliamentary Under-Secretary of State for Mental Health and Women's Health Strategy. Suicide is, incidentally though, the biggest killer of men under the age of 50 these days. But sure, Keith, mental health doesn't matter enough to you anymore to warrant a cabinet portfolio post. Well, you did once though, didn't you? At the 2021 Labour Party conference, you said that you would guarantee mental health treatment within a month for all who need it, setting a new NHS target, ensuring that patients start receiving appropriate treatment within a month of referral. And you also said you would be recruiting 8,500 new staff so that 1 million additional people can access treatment every year by the end of Labour's first term in office. You would also put an open access mental health hub for children and young people in every community, providing early intervention and drop-in services. And you would also provide specialist mental health support in every school so that they can support pupils and resolve problems before they escalate. That there will be a full-time mental health professional in every single secondary school and a part-time professional in every primary school. You also said that you would improve service quality, bringing in the first ever long-term whole government plan for improving mental health outcomes, making early intervention a reality and broadening the range of services to those with severe mental health illnesses. And you would give mental health its fair share of funding, pledging that NHS spending on mental health would never fall, and a fair share of mental health funding every time new funding is provided to the NHS. But it's all binned now, I suppose, yeah? Problem is still there though, so what gives? Why now? Why have you done this now? Maybe there's a more base, more childish reasoning behind Starmer's flip. It's certainly something people are talking about on social media, and that is this post, this mental health brief that Starmer is now bidding was, after all, created by a certain Jeremy Corbyn. And the first MP given the role was Luciana Berger, and she saw how seriously she took the role by flouncing out to start up the funny tinge party Change UK. Starmer is such a small-minded individual, for many, they would not put this past him to ditch the post on that basis. But if that is the case, why has he waited until now to do it? Well, despite Starmer's evident indifference to the role and to the mental health crisis, the last holder of that post, or the most recent one, Dr Rosena Allin-Khan, did try and make a good fist of this role. She has regularly brought up the subject of needing better mental health provision, more mental health beds, more staff. Heck, it's all stuff the whole NHS needs, really, isn't it? But this is her brief, and so she fought her corner on it. An actual NHS doctor, as she is, still does shifts to this day. The kind of second jobbing I actually don't mind at all. And she's just been shut down each time by the health minister, her boss, Wes Streeting, who instead bleats about increasing private provision, utterly wedded to whatever NHS reform Keir Starmer vaguely mentions without ever any detail, unless we forget Streeting decided to make a disgusting dementia-related slur aimed at Jeremy Corbyn just at the end of last year that was picked up on the Commons microphones when he referred to Corbyn as having gone senile. Both Starmer and Streeting are also recipients of substantial private health funding, so it's little wonder why Starmer has a wet fart like Wesley in charge of the shadow health brief and not the far more qualified NHS doctor, which would seem to be the obvious role for the obvious person for the job. But then Allin-Khan genuinely wants to help the NHS, and Starmer and Streeting are just going to keep going where the Tories left off. So, Rosena Allin-Khan, with her post being abolished, supporters of Stormzy, the Stormtroopers, are saying, well, she can't have resigned if her post was being abolished. But then her resignation letter reveals this has been on the cards for a little while, and she doesn't exactly hold back in her swipe at Starmer, because in it she wrote, "You made clear that you do not see a space for mental health portfolio in a Labour cabinet, which is why I told you many weeks ago that I would not be able to continue in this role." In other words, Starmer isn't so much abolishing the role, more demoting it from cabinet level, reducing its importance, and that is something Rosena Allin-Khan cannot support him doing, and so will not continue in that role. That's called a resignation. It has also had wider repercussions, because for all the factionalism we can aim at Starmer and his actions to demote or remove people he blatantly just doesn't like, Allin-Khan is no lefty. She's very much the Starmer type, what they risibly call moderates. What has happened here is that she's put her dedication to health, the NHS, her profession as a doctor first before her politics, and that exposes pretty blatantly the Tory lightism that is driving red Tory Labour. But maybe it's a sign of things getting worse, not better, because with people like Allin-Khan out and promotions for others like the singularly dreadful Blairite Liz Kendall, who is now being put in charge of work and pensions, maybe Labour still isn't right-wing enough for Starmer. And even these so-called moderates like Allin-Khan are now too left-wing for him. Whatever the conversations behind closed doors of the Labour Party, though, Starmer has once again abandoned another policy position, has once more thrown vulnerable people under the bus, and his devotion now to the private health sector just makes me think he's had conversations there that perhaps there's just no profit in mental health for the lobbyists handing him and Streeting their 30 pieces of silver to damn the NHS with further. What do you think of this resignation? Kudos to Allin-Khan or too little too late? Is this electorally damaging to abandon mental health for Labour, do you reckon? Have your say on this story in the comments below. Let me know your thoughts on this. Thanks for watching. I hope you found this video useful. Please like, share and subscribe if you did. More content out daily. Meanwhile, here's video recommendation where behind the scenes there might be an even more to this healthcare civil war happening within the Labour Party right now. And I'll hopefully see you on the next vid. Cheers, folks.